healthcare is one of the key offerings over senior living, but then it's more on, in our case, it's more on preventive side, right? It's not at the forefront, but then working at the back end.
So for us, there are two parameters to look at health. One is how healthy are you on a given day, right? On that day. And that there are a lot of industry good practices, a set of lab tests you can do, radiology tests you can do. So see how are your various organs functioning and overall health functioning on a given day. But just because everything seems reasonably okay on a given day doesn't mean your next 5-year risk is also zero.
Independence of the freedom would again start with the health. When you are healthy, you have got all the freedom to, make choices in terms of what you are going to do. Right, so active living facilities, surely when the healthcare part is taken care, will give you that sense of independence.
If you are 55, 50 plus and you want to live in a place where you have all the comforts of a home, all the feel of a home, and at the same time you want the safety net of being taken care of health-wise, then senior living is fine.
Hi. So when we talk about senior living, the real aspiration is not about adding years to life, but life to years. And when we talk about healthcare, it is more about proactive action towards life and healthcare rather than reactive towards any medical emergencies. So in today's episode, let's discuss about the concept of healthcare and the choices for senior living in terms of healthcare. So to discuss this with me, we have founder of Cradle of Life, Mr. Sharad Gadsing, and a CEO of Bridge Health, Mr. Karan. Welcome to today's podcast.
Thank you, Dr. Murali.
So, Sharad, people often consider healthcare as something which which is very reactive, and when somebody has an emergency to react to it. So, let's discuss how does a Cradle of Life think about healthcare? So, when you thought of a healthcare partner for Cradle of Life, what was in your mind? What are the aspects you are fear? What are the no compromise areas for you in healthcare?
So, sir, even in active living facilities, as of now, it's more, towards the medical care part of it. When in a clinic setup, there is a clinic setup, and then maybe a doctor on call or a doctor who is available for certain time period. But then that's more like a reactive approach, right? What we believe is healthcare should talk about vitality, right? Wherein it's more of the expression of health, the energy that flows throughout the day, to keep them active, healthy, engaged, right? And for everything that you want to do or that everything that you're planning to do, and the facilities offerings that active living facility has got to offer, the resident need to be healthy, not just physically, but then emotionally, cognitively. So it has to start from as basic as addressing the nutrition, taking care of the fitness requirement. How do you keep them engaged, that too meaningfully engaged, so that the emotional well-being or the cognitive health is retained, right? And along with that, medical care, that too on a preventive proactive side, is what should be available in active living facilities.
So, when it comes to healthcare, are there few non-negotiable items for you?
Health as such is non-negotiable. Like I said, everything at that particular age revolves around health, right? That's the core reason for you to be active, healthy, happy. So health absolutely is non-negotiable, but then it has to be part of the daily living. It should not be like a primary offering, but then working silently at the background, so that without resident feeling like they are being monitored, they are being treated. It has to work at the background, is what I believe.
Okay. Karan, when it comes to healthcare after 55, the focus is more on keeping the activeness quotient up and the energy level up. So, how does Bridge Health, come in picture to increase the activeness quotient, to add more life to the life?
Sure. Thank you for that question and the opportunity, Dr. Murli. And Sharad is a great friend. I remember the first time we met, we knew we had to work together because, the values aligned, the perspectives aligned. So very happy to have this conversation. Look, what do you think when you talk of healthcare? You pick up any industry report of healthcare. What do they talk of when they talk of progress? They talk about the total investment in terms of technology in hospitals typically, and they talk of number of beds, right? Now, how often in your lifetime do you need a bed in a hospital? If you look at the number of instances where you need a bed versus where you need some kind of what is called by the hospital as an OPD service, you typically need to go see a doctor and get certain things done and guidance done for primary care largely. What's happened in the last 20-25 years, I think we've made tremendous progress in healthcare in terms of number of bed capacity, privatization, technology. But what we've lost out, I think, is the focus on primary care. And combining that primary care with preventive care is almost non-existent, not just in India. It's a problem everywhere, right? Even US, Europe, NHS, everyone is trying to say, how do we keep you healthy and not let you fall ill so that the cost for the overall system is lower, whether it's for insurance company, whether it is out of pocket. So I think there's a fundamental flaw in the progress that has happened in the last 20-25 years. While the progress is great, no one will want less bed capacity or less hospitals. But you need a parallel healthcare system which works towards two things. One is highly convenient. Why do I have to go to a large hospital to get basic stuff done, primary care done? I think that's one thing that Brijal said, we've got to solve for this. So this whole community care and elder care at your doorstep for primary care. I think that is one problem to solve. The other problem to solve is how do you integrate preventive care while you are taking the opportunity? Because no one comes to a doctor and says, listen, doctor, I've come to you because I don't want to fall ill, to your point, right? But that is what we want to do. We want the doctor to be a harbinger of change, saying that we'll keep you healthy. And I think with Sharad and with his reimagination of healthcare, that's what this partnership is really all about, saying, yes, we will have a clinic, we'll have a setup, nursing, doctor, pharmacy. But besides catering for primary care is defined as cough, cold, fever. Right? Besides that, we have to look at saying, how do we keep you healthy? And having proactive steps, including a very thorough assessment when the person joins our center there and things like that. Right? So I think those are two big pieces, primary care and preventive care.
Okay. Is that the difference between the typical healthcare chains which are available in India and Bridge Health, or is there any added value other than this?
Yeah, I think there are three things, especially in the case of when we're talking of geriatric practice or active living that we are talking in that context. I think there are three big things that we bring to the table. Number one is primary care at super convenience. We're not asking you to go to a hospital facility or off-site facility for most of the things. We are going to try and address most of those things there. That's one. Number two is, if there is a true emergency, then how do we do what we call as triage? This is a true emergency. Stabilize, make sure that the golden hour is extended, and then transfer appropriately, right? So that's a second thing which is very important in this case. But the third thing which I mentioned to you, which is preventive care. How do you get people to be metabolically fit so that as Sharad said, and you mentioned that as well, right? That it's not about just adding years to life. By the way, if you add life to years, you will add years to life. The concept is health span and lifespan. If you're improving health span, you will improve lifespan automatically.
So what's your belief? How does proactive healthcare improve activeness quotient in 55 plus adults?
Yeah. So look, the biggest awareness problem, both among, I would say, the healthcare providers, our doctors, the way they are taught pharmacological interventions, right? That's essentially what, and they're great at it, and you need that. And on the other side, our customers, our regular folks like you and I, we see diseases as different diseases, right? So Diabetes is a separate disease. Cardiovascular and heart attack is a different disease. Dementia is a different disease. But actually, all these diseases are connected. And the basic underlying factor is metabolic fitness. If you are active, and that's where the active living comes in, right? If you're active, if you're metabolically fit, if you have good muscle mass. So, one of the things, for example, we measure, which almost no clinical healthcare provider measures, is the skeletal muscle mass percentage. That has a very high correlation with your good health and longevity, right? So, if you are active metabolically and healthy, you are going to keep all these diseases away. If you have already diabetes or pre-diabetes, it's a disorder and it can be changed. That disorder can be brought to order with a certain protocol. So those are the things that we want to be able to do so that you're delaying the requirement or even eliminating the requirement for going into a hospital in emergency.
Karan, Sharad, when we grew up, I mean, probably our generation grew up, we have always seen a family doctor system. Every family had a family doctor, and he used to be the one person who knew us, who knew our family history, your personality. And he used to be our proactive friend, philosopher, guide, treat our basic ailments, and advise us, and sometimes pull your ears, that you are going wrong here, and advise us when to go to a super specialist. Is there any need for additional medication? So he used to prevent unnecessary medications, all these things. Sharad, did you consider this particular aspect while choosing Bridge Health?
Okay, so the familiarity, factor in case of the family doctor, we all grew up with that, and we all are, kind of comfortable. But then we tend to forget that it's more of an individual driven system, right? It all depends on the skill set that the doctor has got, the accuracy of the analysis that you would do, right? So it's always a individual driven system. Now with what we are trying to do with Bridge Health is, so Bridge Health as a ecosystem is the family doctor, right? So even we are going to have a doctor on campus, but then that individual will be empowered with a lot of technologies, right? So Bridge Health has got many smart scan technologies which will help us to keep the health record of our resident, right? Then they've got a data, when it comes to the historical data, right? The one more factor with family doctor is he knows your lifestyle, he knows the past background, the historical data. But in this case, the technology is solving that problem because they have got a digital health record system. So all the data can be retrieved, analyzed, all that thing. More than that, they have got a central remote consulting team, right? So he's not playing alone. There is a team who is behind it, not just as a assistance to the doctor, but then even the resident can consult with them. So here what we are trying to bring in is, instead of an individual system, it's more like a ecosystem that comes and plays the role of a family doctor. And maybe Karan will be.
I couldn't have said it better, right? That's why I said we are highly aligned and we had to work together. I think Shraddha summed it well. But I would like you to understand the context in which we are doing this. Why have family doctors, the neighborhood family doctors, disappeared? As you correctly said, today for a new qualified MBBS doctor with maybe 2-3 years of experience, 4 years of experience, to set up their own practice takes time, effort, all of that. On the other hand, they have opportunities in existing hospitals where they can go in there. And I know that these doctors really run the hospital practically. While you have specialists, but it is the MBBS doctors with 3, 4, 5, 7 years of experience who are practically running the emergency, practically running, the primary care there. We feel that Bridge Health allows such doctors an alternative system where they can again go back to that family medicine practice and have a good work-life balance as well, while ensuring great convenience for our customers. So yes, using technology is important. Using the convenience of having the clinic right there is important near the neighborhoods or even inside the residential complexes. But primarily, this person, the doctor that we hire, is highly grateful that they are no longer having to work 24, 36 hours in a very different setup. And I'm not saying that's wrong, that's needed, but they have an alternative with Bridge Health of being able to provide the family medicine kind of a practice.
Now, since I'm associated with senior living industry for these many years, in my understanding, what matters to residents is, not the overwhelming presence of, a medical team with white coats, and ambulance in front of you and ICU kind of setup. Rather than that, a system which gives you reassurance that, if I need a proactive care that is available, if I need a reactive care that is also available, and this is a system which can increase activeness quotient in my life. So Karan, how do you think Bridge Health is living up to this requirement?
I think it is the longevity or the period of time that the doctors stay with us. Our retention rate with doctors is immensely good. Both because of the kind of practice we provide, the reasonably good work-life balance that we provide, and the additional continued CMEs that we provide to them in fields which are not even being looked at, especially preventive care, metabolic fitness. So these are things that they are loving and they're even adopting as part of their own health, right? So that is important. If you see the same doctor, yes, on day one, if you see the doctor in a white coat, as you said, family medicine practice, you may feel that. But as you continue to see that person, not just as a doctor, and you share meals together and you're doing community activities together, that bond develops. And I think for us that is as important as the technology, use of EMR, use of smart scan. I think all of that is important. But truly at the end, in the world of AI and technology, it's the human bond that's very important.
Karan, Bridge Health has a unique system of having a health score and monitoring, the basic parameters of residents proactively,
Yeah.
which gives residents a sense of confidence that they are free to travel, easily. They are free to indulge in activities. They are free to indulge in movements, hobbies, etc. Without giving a feeling that they are continuously watched and monitored. How do you do this?
So I think for any of us at any age, but especially after 50, the margin of error keeps reducing, right? Because you've done all kinds of stuff in your life, and now the margin of error in terms of what you can do reduces. All of us want to know how much of margin of error do I have, right? So for us, there are two parameters to look at health. One is how healthy are you on a given day, right? On that day. And that there are a lot of industry good practices, a set of lab tests you can do, radiology tests you can do. So see how are your various organs functioning and overall health functioning on a given day. But just because everything seems reasonably okay on a given day doesn't mean your next 5-year risk is also zero, right? You and I may have very different risks. So how do you look at that? That's where technology like AI is coming in, where predictive analytics can help us understand, yes, you and I may have the same HbA1c today, for example, and that's within normal range. What is my risk and your risk of developing diabetes in the next 5 years? And how aggressive a protocol I need versus you need to make sure that risk comes down, right? I think that is truly preventive care, primary preventive care. So that's where we use technology like Smart Scan, and so it works along with the lab tests, right? So there's a set of lab tests which are done, which tell you how you are today, and then there's a set of technology based applications we use, and it's a combination of these two axes, your current health status and your future health status, that allows us to classify all the residents, for example, in a senior living into red, yellow, and green. And green doesn't mean you can do what you want, right? You still have to follow good protocols of health. But really, we want to be a lot more aggressive with the ones in red and yellow, and make sure that we take care of their health in such a way that that can come back into a green zone. It can be a combination of changes in food, changes in sleep patterns, even things like, for example, how much of weights, a lot of them give up on weights. So weights training is important. So we tell them, think of all of these interventions like medicine, right? You need a minimum effective dose of exercise to be healthy. You need a minimum effective dose of sleep. So we look at all of these non-pharmacology interventions also to keep them healthy. So that's how it centers around the score.
Karan, when it comes to senior living, reactive healthcare also is equally important, especially emergency preparedness and how do you react and take action during emergencies. Tell us something about how prepared Bridge Health is, and how does Bridge Health manage emergencies?
So first of all, classifying people, as I mentioned, in red, yellow, and green itself allows us to understand the ones in red are more likely to, have an emergency, and how do we plan around it. But besides that, typically, what are the kind of emergencies a setup can get? For example, there may be a cardiovascular event. The person may come in actually complaining only of a gastric issue, but we need to be able to correctly triage. Is it a gastric issue or is it a cardiac event? So we, for example, use technology, AI-based DCG is available right there, right? The doctor can remotely see the DCG and make a conclusive evidence. If the doctor is there on site, then immediately the doctor is going to do the immediate protocol of loading those, etc. If it's a cardiac event, stabilize the patient and then transfer them to the hospital. And we've got pre-identified hospitals where we've got a tie-up, where we know this hospital is ready for such an event. They have a cath lab, for example, available, because the person may have to immediately be taken. So it's a 3-step process. One is get the right triage, and that a combination of the right skilled people and technology at the site is important. Second is, once you have a triage and you believe this is a emergency, then we have protocols for each kind of a emergency, saying if this, then this, if this, then this. And the nurse and the doctor are well groomed and trained and enabled to do all of that. That will increase the duration of stabilization, and the golden hour, as we say, gets extended. And then, of course, very important to tie up and send to the right facility, hospital, where they can be taken care of. And our doctor continues to be in touch with that doctor.
The common perception of people about senior living, even now, senior living is already 20-year-old, 25-year-old in India. Even now, people think senior living is a place which is depressing, which will take away your independence, that kind of understanding. When it comes to healthcare, the typical understanding is ambulance. So I'm sure both of you are working to shatter those myths. Now, my question is, how does proactive healthcare play a role in enhancing quality of life and make the senior living place more vibrant?
Yeah, so I'll leave the how proactive healthcare is going to help to Karan. But then in terms of, when I want to address this based on the association that we are having, I'd like to give you a couple of examples. Like, in senior living, we always talk about fall safety, for example, right? But then as a developer, you can only ensure fall safety through infrastructure. But then Bridge Health, for example, has what a fall prevention program, right? So just having infrastructure which is fall safe is not enough, right? You need, so that's the preventive side. So whatever you have as an infrastructure, then it's a program which will make it complete. Otherwise, it's like incomplete. The second part is, emergency management, right? So it's not just about having a doctor in place, the SOS switch in place. You need a system around it to work it properly. And that's where, this association, this kind of expertise will complete the thing. Otherwise, it would remain incomplete.
Yeah, I completely agree with Sharad. So again, I think when you talk of healthcare in a senior living setup, look at 3 different things. There is primary care, as I mentioned, which is, you may not feel you may have fever, cold, cough, and you want that symptoms to go away. Largely may not be a systemically big issue, but we got to solve for that. That you walk into the clinic and you're taken care of right there. Right? You don't have to go anywhere else. Second is emergency care, for which, as I said, right, triage and then maybe transfer to a hospital. That will require an ambulance, right? And the ambulance has to be well equipped. So if that happens, yes, you need the ambulance, but it's in the back of the building. But the third thing is preventive care. And preventive care lends itself to not just a typical clinical setup, but it can be a lot of fun. So we weave, working along with, Sharad, our plan is to weave a lot of fun activities. Exercise can be fun when it is done in a group. When you're doing it by yourself, then it can be a lot of work, especially if you're not used to it. So how do you build social norms and social involvement around preventive healthcare is as important. So, for example, when we identify people who are more likely to fall, we bring that group together and then do exercises and talk with that homogeneous group. And each of them has already fallen once, and they can actually joke about it and yet strengthen their limbs, for example, and work out together for a purpose. So I think it is about it's about leveraging the social context in a senior living, and that's where I think we are a natural extension of what the senior living management, in this case Sharad, is doing.
Sharad, what message you would like to give to people who still think that senior living can increase their dependency, that will take away their independence?
So senior living for core is not a medical grade facility, right? Though healthcare is one of the key offerings of a senior living, but then it's more on, in our case, it's more on preventive side, right? It's not at the forefront, but then working at the back end. Independence of the freedom would again start with health. When you are healthy, you have got all the freedom to, make choices in terms of what you are going to do, right? So active living facilities, surely when the healthcare part is taken care, will give you that sense of independence, right? And when it comes to dependence, here what we have is a very reliable, dependable system, right? So I think both together, one giving you total independence by keeping you healthy, and then that peace of mind wherein you have that peace of mind that even in a critical situation I'll be taken care. I think these two work together, and that will give a great sense of independence, freedom to the resident.
On behalf of Sharad, I would say today, and I think a lot of other players in the industry are doing a great job on this. There's a big difference between old age home and senior living, right? So we've got to differentiate between these two. If you are 55, 50 plus, and you want to live in a place where you have all the comforts of a home, all the feel of a home, but at the same time, you don't want the headaches of having to maintain and manage the home. And at the same time, you want the safety net of being taken care of health wise, then senior living is for you and Cradle of Life is for you. Because these three things, you want the feel of home, you don't want all the headaches of maintenance. At the same time, you want to be taken care of if there's any health issue, because many of these senior livings, they want to give you great ambience, so they fall outside the city limits. But you want to have healthcare system to be taken care of. So I think it's a great balance of these three big factors, which is why you should choose senior living.
Sharad, while choosing healthcare partners, you had so many options. What's so special with Bridge Health? Why did you choose Bridge Health?
So it started with the vision, philosophy, alignment, wherein we strongly believe in the preventive, proactive healthcare approach, and that's the vision Bridge Health is carrying. So there was a great alignment on that front. So another alignment was, we are thinking of doing some new things in senior living, trying to be more creative, innovative, not following the mistakes that we observed in other senior living projects. The same way, Bridge Health also is, deviating from the traditional path to a very modern, very scientific, data-driven approach, wherein they have evolved technologies like AI-based scanning technologies, which are way ahead of what a traditional, healthcare partner would have. So that makes again a perfect compatibility, wherein we are talking about, doing something different, and they are already doing it different. Next is they come as an ecosystem, right? From preventive, proactive healthcare to the medical care to the responsive care when it comes to emergencies. So another, great aspect about Bridge Health is they cover the entire spectrum, right? From the preventive, proactive healthcare, primary medical care that's available on the campus to, let's say, the responsive care when it comes to emergencies, right? So one single agency, a like-minded agency that comes on board, takes the entire spectrum. And the last and the most important part is, apart from the experience, expertise, or the technologies they're into or innovations they're into, the team behind the organization, right? They are very friendly, approachable. They understand you as a client, right? And they come up with a solution that matches your expectation. I think that's very important for us when it comes to choosing a healthcare partner, and that is why Bridge Health.
I have worked with Bridge Health in more than 2-3 projects. So what I found unique with them is, the spectrum, right from proactive healthcare, preventive healthcare, reactive healthcare, and highly customizability of healthcare as per requirements of their clients. And I'm a big fan of old school of family health system and family doctor system. So I believe that bridge in the bridge health is that integration or filling in the gap where the family care or the family doctor system is missing. So that is the biggest advantage of bridge health. That's one of the reasons I found it very interesting to work with them. As a summary, senior living and healthcare is about adding life to years and make life more vibrant and making 55 plus life more enjoyable. Thanks for joining, and for more videos, please stay tuned.